Maria had always been mindful of her health, but when it came to vaginal health, she felt a little lost. She frequently experienced discomfort, itching, and occasional unusual discharge, but was too embarrassed to talk about it with anyone. After searching the internet for answers, she became overwhelmed by the conflicting information and myriad of products promising to keep her fresh. When Maria finally mustered the courage to visit her gynecologist, she realized she wasn't alone. Like many women, Maria learned that maintaining vaginal health is about understanding your body, recognizing common conditions, and knowing how to care for one of the most sensitive parts of your anatomy.
Maria's story highlights a common experience for many women. Vaginal health is often overlooked or misunderstood, yet it's a crucial aspect of a woman's overall well-being. This comprehensive video will explore the fundamentals of vaginal health, common conditions that can affect the vagina, and practical tips for maintaining a healthy vagina. Understanding vaginal health.
The vagina is a remarkable and self-regulating part of the female body. It has its own ecosystem, maintained by a delicate balance of bacteria, primarily lactobacilli, which keep the vaginal environment slightly acidic. This acidity helps protect against infections by preventing the overgrowth of harmful bacteria and yeast. Vaginal health refers to the overall well-being of this ecosystem, which is influenced by factors such as hygiene practices, sexual activity, hormonal changes, and overall health. When this balance is disrupted, it can lead to various vaginal conditions, some of which can be uncomfortable or even serious if left untreated.
Common vaginal conditions. Several common conditions can affect vaginal health. Understanding these conditions, their symptoms, and how to manage them is crucial for maintaining a healthy vagina. Yeast infections, also known as candidiasis.
What it is. A yeast infection occurs when there is an overgrowth of candida, a type of yeast that naturally resides in the vagina. This overgrowth can disrupt the normal balance of bacteria and lead to infection. Symptoms: itching, burning, thick white discharge resembling cottage cheese, and redness or swelling around the vagina. Causes: factors such as antibiotic use, hormonal changes, diabetes, and tight clothing can increase the risk of developing a yeast infection. Treatment: over-the-counter antifungal creams, suppositories, or oral medications. Probiotics and home remedies like yogurt may also help restore balance. Bacterial vaginosis, often referred to as BV, occurs when the balance of bacteria in the vagina is disrupted, leading to an overgrowth of certain bacteria.
It is the most common cause of vaginal discharge in women of childbearing age.
The symptoms include a thin gray or white discharge with a fishy odor, itching, and burning during urination.
Causes can include factors such as dowshing, having new or multiple sexual partners, and the use of scented feminine hygiene products.
Treatment typically involves prescription antibiotics like metronidazole or clindamycin. It's important to complete the full course of antibiotics even if symptoms improve. A urinary tract infection, or UTI, is an infection of the urinary system, which includes the bladder, kidneys, and urethra.
While not directly a vaginal condition, UTIs often cause discomfort in the vaginal area.
Symptoms include a frequent urgent need to urinate, a burning sensation during urination, cloudy or strong-smelling urine, and lower abdominal pain.
UTIs are commonly caused by bacteria entering the urinary tract, often from the gastrointestinal tract.
Sexual activity, certain types of birth control, and poor hygiene can increase the risk. Treatment typically involves antibiotics. Drinking plenty of water and urinating frequently can help flush out the bacteria. Sexually transmitted infections, or STIs, are infections transmitted through sexual contact, affecting the vaginal area among other parts of the body.
Common STIs include chlamydia, gonorrhea, herpes, and human papillomavirus, or HPV.
Symptoms vary depending on the specific STI, but can include unusual discharge, sores or bumps in the genital area, itching, burning during urination, and pelvic pain.
STIs are caused by bacteria, viruses, or parasites, and are spread through vaginal, oral, or anal sex.
Treatment may involve antibiotics, antiviral medications, or other therapies, depending on the infection. Regular STI screening and practicing safe sex are crucial for prevention. Vaginal dryness occurs when the tissues of the vagina are not well lubricated, often due to decreased estrogen levels.
Symptoms can include itching, burning, discomfort during intercourse, and general irritation.
Hormonal changes during menopause, breastfeeding, or the use of certain medications such as antihistamines or birth control pills can cause vaginal dryness.
Over-the-counter lubricants or moisturizers can help alleviate symptoms.
For more severe cases, estrogen therapy in the form of creams, tablets, or rings may be recommended.
Vulvodynia is chronic pain or discomfort in the vulva, the external part of the female genitalia, with no identifiable cause.
Symptoms can include burning, stinging, irritation, or rawness in the vulva that can be constant or intermittent.
The exact cause of vulvodynia is unknown, but it may be related to nerve damage, hormonal changes, or an abnormal response to inflammation.
Treatment may include medications, physical therapy, biofeedback, dietary changes, and avoiding irritants. In some cases, nerve blocks or surgery may be considered.
Maintaining vaginal health involves a combination of good hygiene practices, safe sexual habits, and being mindful of the products you use. Here are some practical tips to help you keep your vagina healthy.
Practice good hygiene. Wash the vulva, the external genital area, with warm water and mild, unscented soap. Avoid using soap inside the vagina as it can disrupt the natural balance of bacteria.
Always wipe from front to back after using the toilet to prevent the spread of bacteria from the anus to the vagina.
After swimming or exercising, change out of wet or sweaty clothes as soon as possible to prevent moisture buildup, which can lead to infections.
Say no to douching. Douching can disrupt the natural balance of bacteria in the vagina and increase the risk of infections. The vagina is self-cleaning and does not require douching.
Choose unscented products. Avoid using scented tampons, pads, soaps, or sprays in the vaginal area. These products can irritate the delicate tissues of the vagina and disrupt the natural pH balance.
Opt for cotton underwear. Cotton is breathable and helps keep the vaginal area dry, reducing the risk of yeast infections.
Avoid synthetic fabrics and tight-fitting clothes that can trap moisture. Change your underwear daily, and more often if you sweat heavily or exercise.
Use condoms. Condoms reduce the risk of sexually transmitted infections, or STIs, and help protect against unwanted pregnancies. Use condoms consistently and correctly every time you have sex.
Get regular STI screenings. Regular screenings are important for sexually active individuals, especially if you have multiple partners or a new partner. Early detection and treatment of STIs can prevent complications.
Stay hydrated. Drinking plenty of water can help maintain moisture levels in the vaginal tissues, particularly during hormonal changes such as menopause or breastfeeding.
If you experience vaginal dryness or other symptoms due to hormonal changes, talk to your healthcare provider about hormone therapy options.
Check for side effects. Some medications, such as antibiotics, antihistamines, and birth control pills, can affect vaginal health. If you notice changes in your vaginal health after starting a new medication, consult your healthcare provider.
Eat a balanced diet. A diet rich in fruits, vegetables, whole grains, and lean proteins supports overall health, including vaginal health. Probiotic-rich foods like yogurt may help maintain a healthy balance of bacteria in the vagina.
Stay active. Regular physical activity helps maintain a healthy weight and reduces the risk of conditions such as diabetes, which can affect vaginal health.
Recognize the signs. If you experience unusual symptoms such as itching, burning, unusual discharge, or pain, don't hesitate to seek medical advice. Early diagnosis and treatment can prevent complications and improve outcomes.
Get regular checkups. Regular gynecological checkups are essential for monitoring vaginal health, screening for infections, and addressing any concerns.
After my appointment, I felt empowered. I realized that maintaining vaginal health wasn't about following the latest trends or buying the most expensive products. It was about understanding my body and taking proactive steps to care for it.
Armed with knowledge, Maria adopted healthier habits, avoided unnecessary products, and became more confident in discussing her concerns with her healthcare provider.
My journey is a reminder that vaginal health is an integral part of a woman's overall well-being. By understanding common vaginal conditions and following best practices for hygiene and care, women can take control of their health and prevent many common issues.
Vaginal health is a crucial aspect of a woman's overall health and well-being. Understanding the common conditions that can affect the vagina, recognizing the symptoms, and knowing how to prevent and treat these conditions are key to maintaining a healthy vagina. Whether it's choosing the right hygiene products, practicing safe sex, or seeking medical advice when needed, taking proactive steps can help you maintain good vaginal health and improve your quality of life. Remember, your vagina is self-regulating, and less is often more when it comes to its care. Empower yourself with knowledge, and don't hesitate to seek help if you have concerns.